那大家早，我们就开始今天的 section。好，那我们第一个 speaker 是外国人，所以我还是用英文来介绍一下哈。Good morning. This is the first session, and our first speaker is Dr. Russo. Dr. Russo is from Italy, and she is very distinguished. He has a board certified in internal medicine and surgery from the Bologna University. Bologna University is the oldest one university in the world, I think so. Yeah, it's the mother of university. Yes, and he is the international speaker of the CPMA, associate president of the SIES, and also the author of the Invisible Facelift. And his topic today is the hanging by thread, the use of reabsorbable suspension thread to restore the aesthetic balance of the face, the treatment approach between past and present. Dr. Russo, please.
Thank you. Thank you. Good morning, everybody. It's a pleasure to be here with you. It's my second time in Taiwan, and I'm so happy to come back here. It's amazing people, and I love your country. Thank you again for your kind invitation. So they invited me to speak about threads. As some of you know me, I have a lot of experience because I started to use these threads in 2011. And I put in my life maybe 4,000 sutures. So, and all the time for me is amazing result on the patient and all people that use this kind. So we start to speak about the aging process. As you can see, Tweety Pie, if Tweety Pie can age, everybody can age. Then it's so kind to see him. Is very important to know then the expression can be different, but all of them have a common goal, to be younger. So this is a movie about the aging process. As you can see, this lady passes from 20 years old to 70 years old in a few seconds, but is what happened in our life. As you can see, the aging process involves in 3D aging, bones, muscle, and fat, and skin. But what happened in the lower face, and the ptosis of the soft tissues enhance the nasolabial fold and the marionette line. So the ptosis of the chin and the lower cheek skin modify the jawline. And when we use the sutures, what is important to understand the difference between ptosis and hypertrophy aging and ptosis and hypertrophy. In the first case is a little bit more different because the first case you can use it. In the second case, when we have hypertrophy skin, it's difficult to have a very good result because the fat is not present. So main complaint different but have a common problem. As you can see, wrinkles, fold, dynamic static, sagging, lose volume, and the aging process become hypertrophic, pigmentation, and skin quality improvement. So the solution, which is the solution, is a correction, a global correction. When we analyze the patient face, we have to analyze it globally and to check which is the best treatment for every kind of patient. And you have to plan a personalized, correct action plan. But what is available treatment method we have? We have many treatment. We have botulinum toxin. We have LNC. We have hyaluronic acid. But we have on the market a lot of sutures. We have Aptos, Epilift, and Relife. Now is by Menarini, PDO threads, and Silhouette Instant Lift. This is my baby. Aptos, as you can see, is come from Russia, and sometimes is so difficult to insert on the face. You have to put more threads to have a good result. This is the Epilift. Now the new name is Relife from Menarini. Menarini relaunched this kind of threads. Is a double needle like our sutures instant lift, and is painted and certified by Menarini. And at the end we have the PDO threads. PDO threads, we have a lot of PDO mono, twin, screw, double screw, cock. But we have a lot of publication in Italy from 5 universities where PDO threads, after a few months you lose everything, because they started to produce collagen type 3. Is not a natural collagen, different from instant lift. We published a very nice publication in a live patient, were analyzed for 2 years, and our result was is natural collagen. After 2 years, we have collagen type 1. So instant lift, as you can see, was born in United States, made in United States, and are very, we have cones, and we have knock. We have 3 kinds of sutures: 8 cones, 12 cones, and 16 cones. So as you can see, for the only difference between 8, 12, and 16 is the distance between, between the one knock and the other one is 8 millimeter for 16 and 12 cones, and is 5 millimeter for 8 cones. When I start in 2012 and 11 to use this kind of sutures, the only treatment we can do was straight line, 1 entry point, 2 exit point. Then in 2012 we started to modify the treatment and become the technique, but at the end we came back because the best one was straight line. The structure of this instant lift is 100% polylactic acid, is conformed to USP and UAP pharmacopoeia requirement. PLA has the benefit of the long-lasting absorption time, over 2 years, as the publication you can see. As a better anchorage with cones. Cones provide a solid support of the soft tissues, no risk of extrusion, and no prickling sensation. This is the difference between cones and barb threads. As you can see, cones has a 360% surface to retain and to give a good, strong anchorage to the subcutaneous tissues. Is a 3D anchorage, but for barbed threads is a bidimensional anchorage, and is as a limited anchorage. And the extrusion is very easy to have. Cones are, as I said, is separated by knock for instant lift. No risk of extrusion. The entire surface of the cone is smooth, and so the patient do not have experienced any prickling effect. Is completely different to the barbed threads. May occur prickling sensation, and sometimes we have high risk of migration and extrusion. So the material The difference between all material are on the market, as you can see, for polylactic acid is our sutures, instant lift, polydioxanone, caprolactone, polyglycolic acid are completely different, and the degradation, as you can see in polyglycolic acid, caprolactone, in a few weeks, in a few disappear. So polylactic acid was observed after 12 weeks. We don't have the degradation. So this is PDO is a very limited effect until 5 months, 6. That's it. Less anchorage and lift effect. You need to put minimal. When I was in Korea with our colleague, they told me you have to put minimal 50, 100 sutures to have a good result, and are not as safe like Silhouette Soft, and maybe you can use in combination with Silhouette in instant lift. Silhouette is a product by Sinclair. Aptos have other sutures, and Korea we have many sutures. But which is the difference? All sutures are on the market are bidimensional sutures. The only one is three-dimensional is instant lift. But it's very important to know the anatomy of this to have a good result with this treatment, and is based on knowledge of anatomy, comprehension of aging process, and treatment planning and sutures insertion. Why the anatomical causes? It's important to know the fat compartment. As we know, the adipose tissues of the face is not a completely mass, but is compartmentalized. This is Rory Cepesa. They study it for many times. Aging is influenced by the modification that arise in each individual compartment, as well as their interaction. So we are the superficial fat compartment, you know, is the infraorbital compartment, the medial cheek fat compartment. We have a nasolabial compartment, middle lateral cheek compartment, at the end the superior and inferior jaw. But most of the time the patient, they come to our office and they want to improve the lower face because they show us this movement. So as we know, the cheek fat compartment, we have the mobility, ptosis, and hypertrophy in the middle face, and the fixing hypertrophy is in the lateral compartment, is the temporal lateral. And what happened? Oh, sorry. I don't know. Sometimes. Okay, but the correct insertion. I put the sutures in this cadaver in order to show, and I colored the threads in black in order to show where is where you have to put, and the right level is in a prismas level. As you can see, the anchorage is so strong, and another cadaver that I put the sutures in Lyon is this one. As you can see, is in blue color. And take a look at the anchorage. Very strong anchorage. When you put it, it's difficult to remove from the cadaver. So another, which is the correct insertion, is in a subcutaneous level, in a superior, medial, or deep level, but is important to be in a right position under the skin, And incorrect insertion is in the dermis or in the muscle. Why? Because the patient feel pain, and if the patient feel pain, you don't proceed to do this treatment. It's important to tighten not the fat, but is important the ligaments. As you can see, the retained ligament, when you insert the sutures, you give a lifting effect, but you tighten the retained ligament and not the fat. And you reposition the skin. This is the lateral temporal cheek fat compartment. It is a fixed part of the face, and is the most lateral fat, and is important because you can fix our sutures in this area. This is the middle cheek fat compartment. Most of the time you have to reposition also this and the medial cheek fat, as you can see on the cadaver. And this is the last one is the nasolabial cheek fat compartment. This is the area that most of the time we have to treat with sutures. In a deep compartment, you have to treat with fillers, with hyaluronic acid, what you want, to give projection, to give volume. But in the superficial compartment, it's impossible to inject hyaluronic acid, otherwise you have hypertrophic reaction. In superficial, we have also, as you can see, the malar fat pad is composed by infraorbital compartment, medial cheek fat compartment, and nasolabial compartment. At the end, the superior and inferior jowl. This is important because you have to tight when you cannot do nothing with a filler. You need threads for this treatment and to reposition. But be careful to the risk zone of the face is the temporal branch of facial nerve, the marginal mandibular branch of facial nerve, and the buccal branch of facial nerve. This is the area where you have to be careful. But remember, the marginal mandibular branch is deep, and also the buccal branch. The temporal branch is a little bit more superficial, but is difficult to pass through with our threads. Understanding the key concept is very important because first, when you analyze the patient face, you have to consider the area where you treated, and decide which is the compartment, which is the area where you want to improve. Second is very important, a careful analysis of the patient to select the patient, otherwise the risk is to have not a good result. And efficient pulling point, because sometimes if you don't prepare very well the pulling point, and you don't prepare very well the vectors, you don't study the patient face, is a little bit difficult to have the result for the patient, and to determine the appropriate technique. So, as you can see, I wanted to summarize the fat change, superficial fat change, and that not change with age, but only with skin, with weight, with skin metabolism and body protection. Muscle change and lose mass with age, and with a permanent contracture displacement of the deep fat. At the end, we have the deep fat loses volume, slides, and stopped by strong retained ligament. So this is very important. Fat change, muscle change, and deep fat lose volume. So as you want to consider the area to treat. Superficial cheek fat compartment, and most of the time the patient arrive and want to improve the nasolabial fat and the superior and inferior jowl. These are the areas where you can have the best result with your these sutures, and you have to select the patient. As you can see, In the first case, the patient has not need to improve nothing. Eye sagging and the sagging in the second half part, and severe sagging. In severe sagging in Italy is difficult to treat, but sometimes I try to treat with satisfaction for the patient. But you have to check the skin all the time when the patient arrives if he's a good candidate for this treatment. And you have to assess which is the severity, sagging, and to assess the quality of the skin. Another important thing, to determine the most efficient pulling point. When you select the area to treat, find the efficient pulling point at the end, the vectors. You have to decide which is the best vector. Vector should be the most perpendicular as possible to the area to treat. And as you, in this, sorry, I want my, okay. The last cone, the last cone, you have to decide where we'll go. Sorry, which is for the light? This one? Which one? No laser? Ah, okay, okay. Okay, no problem. You have to select when you decide to improve the lower face, and you find which is the pulling area, the point to decide where you insert the first entry point. Then identify where the last cone should be placed and mark the exit point. Is important because you have to decide, we have sutures, 8 cones. For 8 cones you have to take from entry point to the exit point minimal 5-6 centimeter. And you have to imagine where is it the last cone, and you take 1.5 centimeter over the last coin, and you mark in this way the exit point. So from the position point of the last cone, measure the entry point. Thanks to the ruler, we have a ruler in your hand, and 5-6 centimeter depending on the skin laxity, and the last exit point is 6-7 centimeter. From the position point of the last cone, measure the entry point is a C, thanks a ruler, 8-9 centimeter depending on the skin laxity, and this is the direction, is a straight, because if you have a straight sutures, you have a very good anchorage in the temporal fascia, and nothing move. And the last exit point is D, is 9-10 centimeter minimal. So the insertion process, first insert the distal side of the sutures, then the second insert the proximal side, and at the end properly position of the most distal cone of the distal side of each sutures. Bidirectional straight line, 1 or 2, both anchorage in the tissues, repositioning of the mobile tissues, fixation point, maintain the result. The vector is very important. If you put is incorrect this application because you are not the correct vectors, sutures position it off the perpendicular and cannot provide to the support and offer a little correction. But the good correction is when the sutures is positioned perpendicular to the skin, and you have to the nasolabial fold, and you have a lifting effect. But which is the best pattern technique? As I said, we start with a straight, Then we pass in a U technique, a D technique, but the positioning and the last cone you can see here. I take my U position here, and the exit point you have to mark after 1.5 centimeter after the last coin. And this one you want to lift the nasolabial fold. You can put 2 or 3 sutures, depending what you want. Or when you want to lift the nasolabial fold and the jowl, you put 3 sutures, 2 in the nasolabial fold. Also, in this case, the last cone you have to mark 1 centimeter, 1.5 centimeter before the exit point. This is just for the jowl. The anchorage in under the jawline, you can see is the entry point is in the mastoid area, and the anchorage is in the back of our head, because the mastoid area is very strong anchorage, and normally you have to use in this case minimal 16 or 12 cones. For the straight on the jowl, 12 is my advice. Another possible is 1 straight, 12 cones, and 2 8 cones for the marionette line. And or when you want to do a full face, you have to put 5 or 6 sutures. Normally, I prefer don't put all these sutures in 1 step, but in 2 steps is better. It's more comfortable for the patient. And just to show all possible is, this is my patient, 1 for 3, 12 cones, sutures, what you wanted to achieve. If you wanted to lift the lower face, if you wanted to lift the mid face, the marionette line, and or depending what you wanted to do, 3 8 cone sutures, 2 8 or 2 12, and 1. So, or you be careful to the ligament. I try to put the ligament is the zygomatic ligament. The entry point I have to put before the zygomatic ligament, because it's another strong anchorage. This is my new idea about these threads. I put in this lady 2 threads, just 1 entry point, and in V technique, I enter in a V technique, I leave a loop, and I pass through this loop with another 8 cone sutures at the anchorage I will do in the temporal fascia. So the type of patient you can use sutures, as you can see, ideal patient. This is my face because I'm a good candidate for this. Unsuitable patient, hypertrophic, excessive skin in the mandibular region with a thick skin, or excessive advanced aging process, or hypertrophic skin, or too lacking fat tissues. The therapeutic approach, you can use sutures in the first case in hypertrophic phase. Ptosic hypertrophic is better to use volume and sutures. In ptosic hypertrophic, sutures is the first choice you have to do, and then if it's necessary you put some volume, and in hypertrophic phase you try to put the sutures, otherwise is for surgical lifting. So we have to summarize for unsuitable patient, excessively advanced aging process, poor skin quality, hypertrophic type of aging, and suitable patient, not excessively advanced aging, good skin quality, and good fibrous adipose tissues. So in Italy, they started to put to come to our office about 40, 45, 50 years old. I saw in your country is a little bit early than in Italy. And when you have to check the suitable patient, you have to move the skin up and down, and to see if you have a good result on the lower face. Ideal patient for Asian people, moderate fat level and relatively thin skin without hypertrophy, or unsuitable patient, too young or have a round puffy face with heavy tissues. Borderline patient, she is 80 years old, is my patient, and she wanted to put the sutures, and I analyzed her face. Why not? I tried. She was happy, and this is a borderline patient, if the patient agree about this treatment. So borderline, another borderline, or you move, you have not a completely result. So after the sutures, you don't have a perfect result. 5 criteria for successful is aesthetic analysis, accurate evaluation of type of aging, type of skin, patient requirement, what the patient want, positioning of the sutures and choice of the sutures 8, 12 or 16. Treatment is very simple, quick, safe and effective. No incision, no surgery, and just a local anesthesia in 20-30 minutes to be performed in your office without need operating theater. No serious side effect in everywhere in the world. Slight bruising 1 week, edema sometimes 24-48 hours following treatment. Possible temporary entry point depression. This is Safe is my nurse, and during a peer-to-peer in my office, the doctor put the sutures in one side and had a depression, and I took a picture for every day to know which is the result. As you can see, the depression of the entry point disappear, and the result improve as past time, before and after 3 months. This is the result. She has a very heavy skin, is a difficult case to treat. Effective, immediately post-treatment result, limited downtime, long-lasting correction, over 12-18 months. And it's very important to accurate disinfection. Pre-surgery drawing, this is important, local anesthesia, and prepare your entry point with a needle 18-19 gauge, and you have to enter for 3-5 millimeter inside the skin. The quantity you have to put is minimal 2 or 3 for each side. Is the bidimensional retraction and the repositioning the cheeks, and the increase the zygomatic process and the definition the jawline. This is the effect of this treatment. This is my patient before and after 4 months. The change, the reshaping of the face, the lower face changed the same in 4 months. So after 60 days, take a look at this lady, 72 years old, in frontal position. My secretary, after 6 months, she is younger than the first time. This is a patient that came in 2012. Just I started to use Silhouette Soft, and I didn't see her for maybe 2 years. And when she came back, the result was in May 2014 and in June 2015. And I didn't put other sutures. This is the result before and after sutures. Other lady, after 2 months, and in combined use with polycaprolactone after 2 months, and after 4 in combination with polycaprolactone. This is a lady that I show that I put the sutures in my new technique before and after stem cells, and after sutures and stem cells in lateral position, just the stem cells to improve the quality of the skin. And after 60 days with the combination with sutures in 3/4 position and in lateral position, the result is amazing result in a difficult case because she has 65 years old. So other patient I want to show. After 6 months, the result is I decide to show you a very difficult case, is hypertrophic face, and after 6 months, this is the result in lateral position. The other side, after 6 months. Other lady, 58 years old, and heavy skin, difficult case, botulinum toxin in the lower face, and is combined use with sutures, and this is the result after 93 months, 90 days. All the time you have a good result. The alternative to silhouette instant lift treated is to take, if you don't want to use instant lift, you take your patient, put in the car, and you go fast. Thank you for your kind attention.
Thank you for your excellent speech. We still have many times for discussion. Any question from the audience?
Thank you, Dr. Russo. I'm Dr. Wang from Taipei. Instant lift is very good to treat the superior and the inferior jaw compartment. It's my experience. But to treat the nasolabial fat, yes, I think it's not easy to design because the Asian people, if we use 8 cones, we try to like 5 centimeters, then the entry point will be around
before the zygomatic ligament.
Yes, and so it makes the zygomatic arch bigger, and we don't like that. So, what's your opinion, or do you have another design method to?
I show my new technique. If you want to try 2 8 cones, 1 entry point. You enter in view technique and you leave a little loop, and then you enter through the loop with the second 8 cone sutures, and you anchor it in the temporal hair, and you lift with 2 just in the nasolabial fold.
Okay, so your entry point, the loop entry point is above
the zygomatic ligament, above the superior part of the zygomatic bone. You enter here, exit point after the nasolabial fold, because as I said, the pulling point is very important. And for example, the cones is you take a measure of 6 centimeter, you take 7.5, and your exit point is over the nasolabial fold, because the pulling point is here, is this one, and the last cone you have to localize there.
Okay.
Okay?
Okay, I will try that. Thank you very much.
It's my pleasure.
Hello, Dr. Rosaba.
Yes.
Buongiorno.
Buongiorno. Thank you in Italian language.
I'm Dr. Chu from Taipei. In a patient, you mentioned about treatment with stress and stem cells as well.
Yeah.
Right?
Yeah.
I'm interested. How do you perform stem cells treatment for that patient? Do you inject locally or do you inject intravenously?
Oh, thank you for this question. Thank you so much, because I think the future is the regenerative medicine. And in Italy, my friend, Dr. Alessandro Gennai, a plastic surgery, invented a kit where you can take a fat in abdomen area. It's very easy to do, and because it is in 1.5 centimeter under the skin in the fat position, you have the most number of stem cells. And so then you have to take minimal 6 cc of fat, and then you move from one syringe to each other, because the cluster of fat is big. You have to break it and to have a lot of stem cells. After that, you put a cannulas and you put in the periorbital area, in the nasolabial fold, and then you can do what you want. Is a very nice treatment. I think is the future, because the regenerative medicine is very important now.
So you mean you inject nanofat, right?
Yeah.
So you inject intradermally or subcutaneously?
No, very superficial, because you have to improve the collagen, you have to improve the hyaluronic acid, the vessel, and the life of the stem cell is about 5 months. After 5 months, you have to repeat the treatment for this area. But if you think about the periorbital area, you inject the hyaluronic acid, it's impossible because you have a complication. But with a stem cell, you can improve all this area and in the barcode of the lips. This is my new idea.
Yeah. So the method is developed by Patrick Tonat, right?
Yeah.
Okay. Thank you.
Yeah. Other question? Thank you.
I have another question.
Yeah.
What's your opinion about the treatment of neck? I mean, using the InstaLift, because I tried some, but I don't think it's good result.
It's very difficult. When you treat the neck, you have to start first in the upper part of the face, in the lower face. The neck is the last one you have to treat. Also, in this case, you have to check which is the best technique, because sometimes the skin is very thin. But in my opinion, you can use the entry point in the back of the neck.
Yeah, I tried that. It's very difficult to
I know.
It's
And it's painful for the patient. Otherwise, you have to enter in the mastoid area and exit in the middle of the neck. This is the only way. You put 1, 2, or 3, depending on what you want to achieve. This is the only way to improve the neck.
Okay, thank you.
You're welcome. And you have to use 12 or 16 cones, not 8 cones. It's not enough. No question?
I have one question. Do you recommend to use the instant lift combined with the liposuction or fat transfer, or you just use the narrow fat?
Sorry, I don't understand.
Do you use the instant lift combined with liposuction or fat transfer?
No.
You don't recommend?
No, I don't use with liposuction because it's difficult for Italian patient. But after 1 year after the surgeon, lifting is the best way to improve and to maintain the result of the surgical lifting. Or when I decide to put the sutures, I prefer first sutures and then the other procedure. When you use a laser before, 1 day, 2 days, 1 week before laser and then sutures. But when you use fillers, the best is to put first the sutures and then fillers. Because otherwise, with hyaluronic acid, you find under is like a ice, and the anchorage is not good after the procedure.
So you don't recommend to use the filler and the thread at the same day?
Depending if it's in the same area or in different area. If you use in the same area, I prefer in two steps. If you use in 2 different areas, you can use sutures in the lower face and volume in the middle face. Thank you for this question. Very important. Thank you.
Any question?
Good morning. Considering the neck rejuvenation, I saw some doctors use a technique with 1 entry point in the midline and put the thread laterally. What's your opinion on this? And second, because the direction of the cone will it cause the crampiness.
I don't use this kind of treatment because, as you said, the direction of the cones are you have to crash every skin in the middle, but our tools, our goal is to lift this area. This is why I don't like to use that one. But you can use one entry point just with a V technique, and you tight in the lateral part of the neck. This is the only way. Because if you put entry point, exit point, one, you collect the skin in the middle. During the live in Barcelona, Dr. Hong showed this technique, but for the double chin. I don't know. He was very happy about this technique because, in his opinion, he had a very strong, a good result. I didn't try to do it, but in the next time maybe I try. For me, in my opinion, but I agree with Dr. Hong, with Dr. Pizzamiglio and other. They want to use straight. Why not? You can do depending on what you want to achieve. The problem, I think, is in Italy. The skin is very thin in European people. In Asian people, the skin is a little bit more thick, and maybe this treatment can do a good result.
Any other question?
Hello, good morning.
Good morning.
Do you have any experience in upper face eyebrow lifts?
Upper face?
Eyebrow lifts.
Eyebrow lift, yes. I use it. Thank you for this question because I not use a lot in upper part of the face because I think the best treatment for the upper face is the botulinum toxin. But I use it when we have asymmetric problem, like after accident road, paralyzed in one side, and I want to balance one side with the other one. First, botulinum toxin all the time, and then I put the sutures in the eyebrow in order to balance the two eyebrow. Normally, the botulinum toxin is the gold treatment. But if you want to improve and to elevate again, you have to put first botulinum toxin and then sutures. But in my experience, just when I have a problem in a very strong asymmetry of the face.
Last question.
Thank you for your speech. Do you think radio frequency or high intense focus ultrasound will distract the integrity of the suture? If the patient wants to receive the NH-based device treatment, how many months should he wait?
Okay, if you want to do after the sutures, minimal 6 months. But normally, if you want, you have to do 1 day before, and you combine this treatment because you have the same action. You stimulate with radio frequency, you stimulate the collagen with the lifting effect from sutures. It's the perfect combination, but you have to do radio frequency for the first day, and the second day you put the sutures. It's a fantastic result.
Okay, thank you. And what's the lasting period of the sutures?
Long lasting?
Yeah, long lasting suture for like several months.
1 year in my experience. So 1 year and a half, depending the patient from the patient. But I have to underline one thing. In Italy, patients become crazy about the sutures, and after 6-7 months, they come back and they want another one. And for me, it's difficult to say really the long-lasting is 1 year or 2 years, because when they see just a little worsening of the face, they come back to my office and they want other sutures because the result is amazing.
Okay,
thank you.
Thank you.
Okay.
Hello, me again. Do you have any kind of complications? What's the most serious one, and how to solve it?
Oh, okay. I can say in 7 years, I have just some ecchymosis, hematomas 1, but nothing had. Because if you be careful when you insert the sutures, you observe the sterility, and you put in the right position, is very difficult to have a complication. The only complication all over the world they observed was in France, a complication for just for depression entry point. But every complication is not a real complication, because in 2-3 days everything disappears. Hematoma or bruising in 1 week to 15 days disappear. Maybe you can have hematoma also with hyaluronic acid, with other procedures, not a problem. The infection, the only big problem, we have 2 or 3 cases in France, but you have be careful when you insert the sutures. Don't touch everything when you have sterile gloves. And I don't have other complication. In my opinion, is one. I had the complication with a filler. I had the complication with botulinum toxin, but I can say I don't have complication with threads. Thanks.
Okay, thank you.
Hi, Professor, and I can ask a question for do you have experience about the treat a nasolabial fold, immediately the lifting with the narrow fat or the filler, immediately time to treat the nasolabial fold wrinkle? Because the nasolabial fold, not just the we not just the lift, we still have to treat a wrinkle. You said you have the narrow fat, right?
Yeah.
Yeah, use the narrow fat. Do you have the perfect combined the time that before or after, 6 months or immediately?
About sorry, I don't understand very well. About the fat in the nasal.
In a nasal fat wrinkle.
The wrinkle.
Yeah.
Okay. As I said, with doctor asked me before, the first procedure is the threads. Then you can wait 1 week because the inflammation have to disappear. After 1 week, you can insert hyaluronic acid, what you want. It's not a problem in the nasolabial fold. Yes?
Thank you.
You're welcome.
Okay, thank you. If any question, you can ask after the Professor Hans' lecture. And from the organization, I would like to present the plug for Dr. Russo.
Thank you. Thank you so much.